Did you know that there are 130,180 deaths due to lung cancer just in 2022 in the United States, according to the American Cancer Society? Hi, my name is Emma Carezzi, and today I'm going to be discussing what lung cancer is, treatments that are available, and ways to prevent the illness. To start, what is lung cancer? Well, it is known as the overgrowth of cells starting in the lungs. It is typically caused by toxins, smoking, or family history. So, if one of your immediate family members, like your mother or father, had been diagnosed with lung cancer, then you are at a higher risk of getting the disease. It is typically divided into two categories, which is the non small cell and the small cell. The non small cell is when an adenocarcinoma, um, that is the type of cell that is overgrown in the lungs, and the non small cell, the small cell, which is fast growing and it tends to spread rapidly. Um, Lung cancer begins at a stage 1 and can advance to a stage 4, which is the most destructive in the human body. And stage 1 is when the cancer appears in only one lung, which is a cell overgrowth that forms what is known to be a tumor. Stage 2 is when it spreads to the lymph nodes, which is the organs that are part of the lung and also a part of the respiratory system, and they are inside of your lung. And a stage 3 is when it spreads to the other lung and the surrounding tissues, and this is when it starts to get a little bit bad for a patient. And lastly, a stage 4 is when it spreads to the other organs in the body through the bloodstream and is also known as the worst advancement of the disease, sadly. As we know, there is no known cure for lung cancer, but there are several treatments that are available to patients that can help prevent the cancer from spreading and also tries to kill the remaining cancerous cells. The most common treatment options are chemotherapy, radiation, and surgical removal. Chemotherapy is issued through an IV, usually in the arm, and it uses several drugs that occur in cycles lasting up to several years. So usually it does not work right away, and once they start to see the cancer stop growing is when your cycle typically ends. They don't usually give that much chemotherapy at one time because it tends to weaken the body and it tends to cause fatigue and often makes a person feel very weak. Radiation is the other option. It uses high energy rays that target the cells, and cycles last from months to years. It is usually shorter than chemotherapy. And then there is also surgical removal, which is when the tumor is surgically removed and can be paired with either chemo or radiation to kill what is left of the cancerous cells after surgery. So if you get a tumor removed through surgery, you can also use chemotherapy or radiation afterwards to kill what was left, because usually in a surgical removal, a surgeon cannot remove the entire tumor. This is statistically the best treatment available to patients, with a success rate of 69% according to the American Cancer Society. There are several issues with these treatments, however, such as they make patients weak, as I already stated, and it can also cause hair loss, and they can also be very expensive for a person to pay for. It also depends on a person's insurance. But the cycles of chemo and the cycles of radiation can add up also with a surgery. They are very expensive. On the other hand, there are several ways to help prevent being diagnosed with lung cancer. The number one prevention method is to quit smoking. Smoking distributes unhealthy toxins into the lungs and also weakens the immune system at the same time. It makes it very difficult for the body to kill the cancerous cells itself. It also is known to reroute the DNA of the cells, which changes its normal functionality, and also changes the growth. So this is why smokers tend to become at a higher risk of lung cancer. Next, routine screening is also a way to prevent it. Finding cancer at a stage 1 has statistically made it easier to treat rather than catching it later at a stage 4 when it has already started to spread. If it's targeted in one area, it makes it easier to treat rather than multiple areas. And physicians don't usually require screening of the lungs because radiation exposure can be damaging as well. But the chances of finding lung cancer during these screens helps boost the person's chances of survival, because if you find it earlier, like I said, it's easier to treat. If you find it later, you have a less likely chance of surviving, as sad as it is. But lastly, wearing masks in a polluted area protects a person from inhaling toxins into their lungs, which is one of the known causes, toxins in the lungs. This is important for those who work in polluted areas such as power plants, as they would be inhaling poisonous air on a daily basis. This puts them at a higher risk. And I have actually a first-hand example was my dad, who he worked in a very polluted area, Chester, Pennsylvania, where there was power plants and factories all around him. And he was actually diagnosed with stage 4 lung cancer later on in his life. As you can tell, these definitely put people at a higher risk, as American Cancer Society states as well. It is important to know the survival rate of lung cancer as well. They also state that the localized survival rate, meaning the contained, like if the tumor is contained in one area, of a non-small cell case is 65%, and distant case is 9%. Distant meaning when it has spread to other areas in the body. But all in all, lung cancer is one of the leading causes of death in the United States, and it is important to know what causes it and how it begins, and also important to know how to prevent it in the future. It's also good to identify yourself, see if you are at a higher risk, because a person who is a smoker, has family history, is at a higher risk than others. Thank you for your time.